May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Loknete Dr. J.D. Pawar, College of Pharmacy, Kalwan, Nasik. I welcome all of you in this last lecture, that is lecture 6 of Anticancer chapter. In this chapter, that is in lecture 6, or in this video, we will cover hormone and monoclonal antibodies. Learning outcome. After completion of this topic, the student able to understand mechanism of action and uses of hormone in cancer and understand the production of monoclonal antibodies and important monoclonal antibody with their uses. The first one is that is cancer use of hormone in cancer therapy. So hormone therapy for cancer. Hormone therapy is a treatment that uses medicine to block or lower the amount of hormone in the body to slow down or stop the growth of cancer. So what are the hormones? These are the natural substance made by glands in our bodies. They are carried around our body in our bloodstream and act as a messenger between one part of our body and another. Hormones are responsible for many functions in our body, including growth and activity of certain cell and organ. The endocrine system is the network of glands that make hormones. Now, how hormone therapy work? That is mechanism. Some cancer use hormone to grow or develop. This means cancer is hormone sensitive or hormone dependent. Hormone therapy for cancer use medicine to block or lower the amount of hormone in the body to slow down or to stop the growth of cancer. So the hormone is utilized as a medicine in cancer which is hormone sensitive. Hormones not used in all type of cancer, but there are some cancer which is depend on the hormone to grow. So this hormone mainly used for the hormone sensitive cancer, but not to all type of cancer. So cancer that can be hormone sensitive, which include breast cancer, prostate cancer, ovarian cancer, and womb cancer called as uterine or endometrial cancer. So in these four type of cancer, hormone used as a medicine. The first one is breast cancer. The female hormone estrogen and progesterone affect some breast cancer. Doctors describe this cancer as a estrogen receptor positive, that is ER positive, estrogen receptor positive, or progesterone receptor positive, that is PR positive, or both. Hormone treatment for breast cancer work by stopping these hormone getting to the breast cancer cell. So in case of breast cancer, the cell having the estrogen receptor on their surface, and this type of cancer cell which having estrogen receptor is called as ER positive, or it may have progesterone receptor on their surface called as PR positive. So it means that this type of cancer cell require estrogen and progesterone in order to grow. So if we stop the or block the provision of this hormone, then there is a less or there is a no chances of growth of this cancer cell. So you may have more than one type of hormone therapy to treat breast cancer. For early breast cancer, to try to stop the cancer coming back. So in that first hormone or drug used for breast cancer is tamoxifen. So it is a structure of tamoxifen. So it is a one type of hormone used in breast cancer. It is most commonly used hormone for breast cancer. women who are still having periods, that is premenopausal, and women who have their menopause, that is postmenopausal, can take tamoxifen. Menopause means there is a when there is a no periods, that is called as, or it is the age after the when the periods are stopped, that is menopause. So this drug utilize the woman premenopausal and postmenopausal. It work by blocking the estrogen receptor. It stops estrogen from telling the cancer cell to grow. So tamoxifen simply block the estrogen receptor which is present on the surface of breast cancer cell. So when we block this estrogen receptor, the estrogen not bind to their receptor and there is a no growth of this cancerous cell. Then second category, that is aromatase inhibitor. So it is important one. In exam many times the question asked about this category, aromatase inhibitors. So it is a aromatase inhibitors. So it is a class of drug. After menopause, ovary stop producing estrogen, but our body still make a small amount of estrogen by changing other hormone called androgens into estrogen. And aromatase is the enzyme that make these changes happen. So in our body, ovary, mainly in case of female, ovary produce the hormone estrogen. But after menopause, there is a no production of estrogen by ovaries. But our body make this estrogen by using another hormone called as androgen. So our body make the estrogen from the androgen, and this making of estrogen from androgen is catalyzed by the enzyme called as aromatase. So in another word, aromatase is the enzyme which is responsible for conversion of androgen into estrogen. Aromatase inhibitor, as name indicate, aromatase inhibitor block aromatase enzyme so that androgen is not converted into estrogen. So aromatase inhibitor, these are the drugs which block this enzyme aromatase and therefore prevent the conversion of androgen into estrogen. Example of this category include anastrozole, anastrozole, exemestane, exemestane, and letrozole. So these are the drugs which use as a aromatase inhibitor. Now see how this androgen is converted into estrogen. So it is a mechanism by which androgen is converted into estrogen by the enzyme aromatase. So it is a structure of androgen. So here if we see here there is a CH3 group. So here two hydroxylation taken place, means two hydrogen is replaced by two hydroxyl groups. In first step, this CH3 converted into CH2OH. One hydrogen is replaced by hydroxyl group. Then in second step, again one hydrogen of this CH2 is replaced by another hydroxyl group. So two successive hydroxylation taken place. So this two hydrogen of this CH3 is replaced by two hydroxyl group. Then there is a removal of water molecule. So here water molecule is removed, so it forms the aldehyde molecule. So OH is removed and this hydrogen is removed. So this hydrogen is removed, shifted here, it become double bond and this OH minus. So it forms the aldehyde. So it is aldehyde formation after removal of water molecule. Then enolization means tautomerism. So here in this carbon there are two hydrogen is present. So from this here one hydrogen shifted here, it become OH and this double bond shifted here like this. So it is a tautomerization. Hydrogen shift to O and this double bond shift to ring. So it is enolization. Then next step, the enzyme. It is the enzyme part, that is aromatase part which contain effid oxygen. then this O minus attack to this carbonyl group, then it become O minus like this. So aromatase enzyme attack to this carbonyl carbon like this. Then there is a rearrangement. So here hydrogen is removed, this bond shifted here, it become double bond in this ring, and this whole bond is break, that is between the carbon and ring bond is break, and we get the product called as estrogen. So it is a mechanism how androgen is converted into estrogen by the enzyme aromatase. So the aromatase inhibitor inhibit this reaction and prevent the formation of estrogens. Now drug, the first drug of aromatase inhibitor is anastrozole. So anastrozole, it is a structure of anastrozole. Anastrozole is used in treatment and prevention of breast cancer in women. Anastrozole is used at a dosage 0.5 to 1 milligram per day in the treatment of peripheral precoce puberty. Precoce puberty means when the sex hormone gland, adrenal gland in boy and girls, ovaries in girls, and testes in boys begin function earlier than the normal. So this drug also used in peripheral precoce puberty means early puberty. The next drug is exemestane. So it is the structure of exemestane. It is indicated for the adjuvant treatment of postmenopausal women with estrogen receptor positive early breast cancer who have received 2 to 3 years of tamoxifen. So this drug also used in breast cancer, mainly the patient which already used tamoxifen. And next drug is letrozole. It is approved by the United States Food Drug Administration for the treatment of local or metastatic breast cancer that is hormone receptor positive or has an unknown receptor status in postmenopausal women. Letrozole has been used for ovulation induction by fertility doctors since 2001. So apart from use of letrozole in breast cancer, it is also used for the ovulation induction by fertility doctors. The anti-estrogen action of letrozole has been shown to be useful in pre-treatment for termination of pregnancy. Letrozole is sometimes used in treatment of gynecomastia. Gynecomastia means enlarged breast in men or appearance of sexual female sexual character in male, that is called as gynecomastia. Letrozole has also been used to treat endometriosis, that is growth outside outside your uterus, that is it is a painful disorder. So it is the main use of letrozole. Then next hormone, that is luteinizing hormone blocker, called as luteinizing hormone blocker. As we know, pituitary gland produce luteinizing hormone which control amount of hormone made by the ovaries. Luteinizing hormone blocker are the drug that stop the production of luteinizing hormone. They do this by blocking the signal from pituitary gland to the ovaries, so the ovaries stop making estrogen or progesterone. Example of luteinizing hormone blocker is goserelin. So it is a goserelin, which is a decapeptide. It is a peptide in nature, contain 10 amino acid. This is used to treat hormone sensitive cancer of breast and prostate cancer. It also be used in treatment of male to female transgender people. So it is also used for treatment of male to female transgender people. Transgender means it does it not male and it not be female. That is called as transgender. Then so these all about drug are used for breast cancer. Now second cancer is prostate cancer. Prostate cancer depend on testosterone to grow. Hormone therapy block or lower the amount of testosterone in the body. Luteinizing hormone control the amount of testosterone made by testicles. They do this by blocking the signal from pituitary gland to the testicles. So the testicles stop making testosterone. So here the hormone required for prostate cancer to survive is a testosterone. If we block the testosterone, then there is a stopping of the growth of prostate cancer. So luteinizing hormone blocker for prostate cancer include goserelin, leuprolin, and trioprolin. So these are the main luteinizing hormone. It is a trade name available in market. It is a in bracket there is a trade name. So example is goserelin, leuprolin, and trioprolin. Triptolin. So triptorelin. Now leuprolin used to in the treatment of hormone response cancer such as prostate cancer and in breast cancer. It may also be used for estrogen dependent conditions such as endometriosis. It may be used for precoce puberty when puberty begins before the age of 8 in girls and before the age of 9 in boys, in both male and female. And it also used to prevent premature ovulation in cycle of controlled ovarian stimulation for in vitro fertilization. It is also used to delay puberty in transgender youth. So it is the main usage of this drug. The next category, antiandrogens. Prostate cancer cells have areas called receptors. Testosterone attaches to these receptors and that can encourage the cell to divide so that the cancer grows. Antiandrogen drugs work by attaching themselves to these receptors. This stops testosterone from reaching the prostate cancer cell. There are different types of anti-androgen, including bicalutamide, cyproterone acetate, and flutamide. So in that first category, first drug, bicalutamide. So it is a structure of bicalutamide. It is approved for and mainly used in following indication. It is used for metastatic prostate cancer in men in combination with gonadotropin releasing hormone analog. It also used as a feminizing hormone therapy for transgender women in combination with estrogen. Feminizing hormone means to induce the female character in transgender, then it is called as hormone which used for this purpose, that is feminizing hormone. Also used for peripheral pernicious puberty in boys at moderate dose in combination with aromatase inhibitor. So precocious puberty means early puberty. Next drug, cyproterone acetate. It is used in combined with birth control pill in the treatment of androgen dependent skin and hair conditions such as acne, seborrhea. Seborrhea is also a skin disease, excessive hair growth, and scalp hair loss. High androgen level in transgender hormone therapy, or to treat prostate cancer, or to reduce sex drive in sex offender, means the person who committed sex crime. So these are the main uses of this drug. It is apart from this prostate cancer, it is also used in acne, seborrhea skin disease, excessive hair growth, scalp hair loss, or also used to reduce the sex drive in sex offender. Next drug is flutamide. So this is the structure of flutamide. It is used primarily to treat prostate cancer. It is also used in treatment of androgen dependent condition like acne, excessive hair growth, and high androgen level in women. It is taken by mouth usually 3 times per day. Then last cancer is womb cancer. The female hormone estrogen and progesterone affect the growth and activity of cancer activity of cells that line the wombs. Doctor use progesterone treatment to help shrink the larger womb cancers or to treat womb cancer that have come back. There are different types of progesterone that doctor can give include medroxyprogesterone acetate and megestrol. So these are the drug of that two drug which are used in womb cancer. So it is about the hormone used in hormone sensitive cancer. So there are four type of cancer where we can use hormone as a medicine. So first one is breast cancer, then prostate cancer, then there is a womb cancer. So that it is about the hormone used